come to the debate on backlogs in the NHS. Helen Morgan to move.
Thank you and a Happy New Year to you. I beg to move that this House has considered NHS backlogs. I just want to start by thanking the Backbench Business Committee for granting me this debate. I applied because many members were interested in having the chance to discuss the problems and consult constructively on the potential solutions for the NHS across the country. And it's ended up being a particularly timely debate given the Secretary of State's statement this afternoon, which we broadly welcomed. The Conservatives have pushed the NHS to breaking point, leaving a legacy that includes the biggest waiting list in history and a healthcare system on the brink of collapse. We've reached a crisis point of backlogs within the NHS system. These aren't just affecting those who are in dire need of medical care, but also the wonderful staff who work tirelessly in hospitals, GP surgeries, dental surgeries, pharmacies, social care providers, hospices, and so on. The situation in Shropshire right now demonstrates the scale of the crisis. The pressure is extreme on every aspect of healthcare and reflects the fact that in many cases it's rural areas that are bearing the brunt of a national problem. Shropshire's NHS has declared a critical incident, one of many across the country I know, as staff battle to cope with the huge winter spike of viruses. And that means that people can't go and visit their loved ones on a regular basis at the moment. They're being required to wear a mask when they go into the hospital. There's just one example of how the system is failing to cope with the pressure. Now, talk about NHS backlogs understandably centres on the 7.5 million cases waiting for treatment. But backlogs also apply to the overflowing A&E waiting rooms and to the long line of ambulances queuing outside. They apply to the elderly people who've fallen and waited many, many hours for an ambulance. And they apply to those possible heart attack and stroke patients being told to make their own way to hospital by West Midlands Ambulance Service at certain times this year. Outside Shrewsbury and Telford hospitals last Sunday, the latest day we have data for, ambulances were waiting an average of 3 hours and 48 minutes to hand over a patient. Across England on the same day, 2,620 patients had to spend more than an hour stuck in an ambulance waiting for space to become available at A&E. We've reached the point, as I mentioned...
Right, Honourable Friend, give way.
I will give way.
Thank you. In my own constituency of Torbay, our hospital faces almost 700 sewage leaks that impact on the ability to provide services. This just is another pressure. Would my honourable friend agree with me that the sooner the government advise what investment they'll make in enhancing our services for our hospitals across the UK, the better?
Well, I thank my honourable friend for his intervention, and actually I hadn't put in the crumbling estate into my speech, and he makes a very, very valid point, because people cannot work efficiently when they're dealing with terrible hygiene and safety issues all around them every single day. He makes an excellent point.
Would you already give way?
I will give way.
Can I commend Ellie for North Shropshire for bringing this forward, and I commend her for being so consistent and assiduous in relation to this issue. I understand from the Honourable Lady is going to come on to the Lib Dem a manifesto, which none of us in this chamber, whether you're a Lib Dem or not, cannot agree with. Does the Honourable Lady agree? In Northern Ireland we have the Health and Social Care Board that has been working on various strategies to reduce the backlog, but the scale is truly significant. Does the Honourable Lady feel that what we should be doing collectively is England, Scotland, Wales and Northern Ireland should be looking at all the recommendations we have, bringing them together so we can all benefit this great United Kingdom of Great Britain and Northern Ireland collectively?
Well, I thank the gentleman for his intervention. He always makes an excellent contribution to our debate, and he's right that we should be looking at the best practice in Northern Ireland and the devolved nations as well as England in order to get the right solutions for the problems that we face. But as I mentioned before, and colleagues will forgive me, I'm not going to take any more interventions because we're very tight on time and a lot of people want to speak. We've reached the point where patients suffering heart attacks are being advised to find their own way to hospital. And how can this possibly be acceptable? Once patients get into A&E, they're confronted with the brutal reality of the backlogs in there. The reality means that only half of patients arriving at A&E in Shropshire were seen within 4 hours in November. The statistics are shocking, but it's individual people with serious problems who suffer as a result. People like my constituent with a pericardial effusion who was deemed fit to sit and left in a chair for more than 24 hours before finally being taken on blue lights to receive the care she needed. And staff in this situation are so overworked that the standard of the care that they give is below the standard that they would like to provide, and the patient's dignity is compromised. And those staff are being driven from the service because they are unable to provide the care that they desperately want to. So until the government puts in place to solve the workforce crisis, there's a risk that these scenes will continue to happen. At my local hospital trust alone, a total of 854,839 hours of nursing shifts went unfilled in the 12 months to October. Liberal Democrats are calling for there to be a qualified clinician in every A&E waiting room to ensure that anyone whose condition is deteriorating is treated more urgently. And we're also calling on the government to publish accessible, localised reports of ambulance response times so that the delays that blight places like North Shropshire and other rural areas can finally be addressed. Now, a key reason for the emergency backlog is that every day around 12,000 hospital beds are filled with patients who could leave if they had a care package in place. That's the equivalent of around 26 hospitals being out of action every day, and that's why Liberal Democrats have been banging the drum for social care. Without capacity in the care system, beds will remain blocked, A&E will stay clogged, and ambulances will continue queuing outside hospitals. So I'm pleased that the government has finally listened to our call for cross-party talks to fix a broken care system, and I look very much forward to constructively engaging with them throughout that process. But we can't afford to wait 3 more years for this plan to be enacted. So I hope the government will reconsider its timescale and get the review done as soon as possible so that the care sector can see the long-term cross-party commitment to reform it so drastically needs. Part of solving the issue is also around preventative measures to stop people needing secondary care in the first place. I went to visit the work of charity Energise and its Elevate programme in North Shropshire, which works to improve fitness and balance and coordination among elderly and frail patients. And it's an amazing achievement. I met a gentleman suffering from Parkinson's who'd been falling 5 times a week before he started his programme. He's now only falling once a week. Now, it'd be great if he didn't fall at all, but I'm sure everybody would agree that's a huge improvement. And they estimate that every £1 invested in that programme, £26 is saved. So this is an area where we can really make a difference to the crisis in the NHS. Now, feud backlogs have as much impact as those in cancer diagnosis and care. Nationally, the target of 85% of patients receiving treatment within 62 days has been missed every month since December 2015. At my local hospital trust, less than 2/3 of patients began treatment within the 62-day target. Improving this is integral to increasing survival rates, and it's key to restoring consumer or patient faith in the NHS, stopping cases like my constituent, whose family felt completely failed by the NHS after he waited almost a year for treatment after first presenting with bowel cancer symptoms. So I'd be grateful if the Minister would clarify whether the government remains committed to meeting the cancer waiting time targets this Parliament as promised in their manifesto, and whether those targets will be included in their new National Cancer Strategy. Again, to achieve the improvement, we need to address key workforce issues, notably in radiology, where there's a 31% shortfall of consultants across the country. And again, in places like Shropshire, which are rural, recruitment and retention issues cause the sharpest problems. Throughout 2024 in Shropshire, it became normal to wait months for cancer test results and scan results, with patients in my constituency only receiving their results after their next scan was due to have happened. Now, I'm pleased to report that under new management, this backlog is now in the process of being cleared. But this is happening due to overseas outsourcing, and that's not a sustainable long-term solution for the country. We do need to retain, recruit and retrain more radiologists, making sure that enough modern equipment is in place across the country so that no one has to wait too long or travel too far to get the scans that they need. And I wonder if the Minister might address whether that will be part of the National Cancer Strategy as well. I'll move on to mental health. We can't talk about backlogs without talking about mental health. The Darcy review showed that 1 million people were waiting for mental health services by April last year, over 340,000 of which were children as a nation who we need to protect because they are our future. CAMHS waiting times are shocking in every constituency in the country. From ADHD diagnosis to anxiety, depression and eating disorders, far too many people are not getting the urgent support that they need. A head teacher of a school in North Shropshire told me that in recent years, 9 students in his school have lost a parent to suicide, yet there are no community mental health services in the town. Now, Liberal Democrats, I think, along with the government, would introduce a mental health professional in every school, but we're also calling on the government to improve early access to mental health services, to cut mental health waits by establishing mental health hubs for young people in every community, and introducing regular mental health checkups at key points in people's lives when they're accessing the NHS, so that we can pick up those problems and intervene early. Meanwhile, GP surgeries are also struggling to handle the growing pressure that's being exerted on them. More than 1 million patients who tried to contact a GP last year couldn't get through. If patients can't access primary care, they seek help elsewhere, or they don't seek help at all. And in both cases, this creates further problems down the line. In Shropshire, we've lost 14.3% of fully qualified GPs in the last 8 years. A young constituent of mine had to wait 7 weeks just for a telephone consultation, a wait that would have been longer if they'd wanted an in-person meeting. Now, Liberal Democrats would give everyone a right to see a GP within 7 days or within 24 hours if it was urgent, using 8,000 more GPs to deliver this. Because if we can improve primary care, then we can reduce backlogs across the health and care system. Yet the government has pledged to increase national insurance charges that could cost GP surgeries the equivalent of 2 million appointments a year. This hike will also hammer pharmacies, with more than a third of pharmacy owners now worried that their business may not survive the winter. If pharmacies close, backlogs just increase elsewhere. If we can keep them open and improve services like Pharmacy First, then we can reduce pressure across the system. We'd like to see the government commit to removing the increase in employers' NICs to support these crucial community services so that fewer people end up in hospital and that they're treated in the community where they'll get better and quicker treatment. Meanwhile, in dentistry, where practices will also be hit by the national insurance rise, there's not so much a backlog of care as an absence of care. 6 million adults in the UK aren't registered with an NHS dentist, and it's becoming almost impossible in places like Shropshire to find an NHS dentist, with increasing numbers of practices handing back their contracts that have become unsustainable. One of my constituents has been trying to register with an NHS dentist for 5 years, while another pulled out his own tooth with a pair of pliers. The Labour government must show it understands this problem better than the Conservative one, whose solution was to introduce golden hello payments. They've been in place in Shropshire for years and they haven't achieved their desired outcome. With this in mind, can the Minister outline what the government plans are in relation to the new patient premium and offer assurances to dentists that any changes will be communicated so that practices can plan and prepare to best serve their patients? NHS contracts need to be reformed so that we can end the use of the term dental desert, end DIY dentistry and guarantee access to people who are in pain. So in conclusion, Madam Deputy Speaker, Liberal Democrats believe that people should be able to take control of their own lives and their own health. That means everyone should be able to access the care they need, where they need it and when they need it. So we welcomed much of today's announcement on elective care, and we welcomed today's announcement on social care. But we're very concerned that the decision to hike employers' national insurance contributions could worsen the crisis in the NHS. Hitting GPs, hospices, dentists, social care providers with higher taxes makes no sense. The Treasury is giving to the NHS with one hand, but taking it away with the other. We also want to see much faster action on social care. As I said, I'm looking forward to engaging with the Minister and engaging constructively to come up with the consensus that we need to, but we can't afford to wait till 2028 for those improvements to be made. Madam Deputy Speaker, the Conservatives' legacy on the NHS is that it's on its knees, and Liberal Democrats understand that there is no magic quick fix to change that. But to give people the care they need and the care they deserve, we must look at the measures needed for the whole service, dealing with both heart attacks and hip replacements with equal priority. Thank you.
The question is, as on the order paper. Jodie Gosling.
Thank you, Madam Deputy Speaker. Nuneaton too has seen record high levels of over 17,000 of our residents on NHS waiting lists. Staff tell me they are burnt out, demoralised and patients are suffering as a result. Long waits on trolleys in corridors, lengthy waits in ambulances and stagnation at GP surgeries where they simply cannot get the appointments that they need. In 2021, the hospital has seen 1,500 staff absences due to mental health, many leaving the profession. Leaders at our George Eliot Hospital really value their staff, but they're struggling to cope with ever-increasing demand and to remain resilient with sudden increases in demand, such as the flu outbreaks over Christmas, leading to a yearly chaos that costs lives, and to longer waiting times for patients, cancelled appointments and a decline in the quality of care. Nationally, we have fewer hospital beds and scanners per capita than most other European countries, and our buildings are crumbling and our computer systems outdated. Our hard-working NHS staff deserve better, and they deserve a government who will respect, value and invest in them. The failures of the past carry a considerable human cost, but it also impacts on family finances and has wider economic impacts on our communities. In one particular case, a nurse from Arbury in Nuneaton, working for our brilliant George Eliot Hospital, clearly demonstrates the damage that can be done. They were in their mid-40s, fit, active, working and economically stable. They were diagnosed with a spinal condition that compresses the nerves in their legs, causing pain. This could be a simple procedure, could be solved very quickly and easily with the right referrals. But a referral to the neurosurgeon had to wait 12 months just to speak over the phone. And the doctors recommended the surgery, and the patient has now been left in limbo ever since, unable to get a follow-up appointment or any information about when surgery will actually take place. A simple procedure which has devastated her life for a number of years. And living in constant pain, she can now no longer stand for more than 5 minutes and has been forced to withdraw from her vital role in the NHS. Another vacancy, another specialist unit short-staffed. And this is just one example of the 17,000 of my constituents, many of which who do not make it to the end of those waiting lists, and I have stood at graves of people in my constituency who have been waiting for treatment that could have stopped them being there. People whose lives are on hold, families who are suffering grief and waiting and more suffering. It's a crisis of political failure, a crisis of underfunding and a crisis of neglect, and I fully support the government's actions to address it. Thank you.
Before I call the next speaker, I want to just inform members that I'm imposing an immediate 4-minute time limit to try and get everybody in. Dr Ben Spencer.
Thank you, Madam Deputy Speaker, and I thank the Honourable Member for bringing forward this important and rather timely debate. First, I must, as always, declare my interest as a now non-practising NHS consultant psychiatrist, and declare that my wife is a NHS doctor. We've just been through the festive period, which is, of course, always a very taxing time on the NHS, particularly for those people who need to work on call through Christmas and through the festive period. That's not just people who work in the NHS, but that's people in all our various emergency services and people who don't work in our public sector who need to work over the festive period. And I think it's important to pay tribute to them and the work that they've done over the past couple of weeks. This debate about the NHS backlog, and certainly in terms of my correspondence, a lot of concern I get from constituents has been over the past few years around getting access to GP appointments. And that's an interesting one because pre-pandemic, the amount of GP appointments has gone up since pre-pandemic, especially with the advent of virtual appointments and through different means of contact. And so what we've seen is very much patients experience that it's more difficult to get in front of somebody in a general practice, and yet overall performance of general practices has improved since pre-pandemic levels. And I think it's important that we support our GP practices as much as we can to make sure they deliver the high quality care that our patients expect, and certainly is something that many of my, we've got fantastic practices locally who are working very hard in tricky circumstances to deliver for patients locally.
Of course. I'm very grateful for my honourable friend. He's, of course, absolutely right. Does he agree with me that it's part of our duty to support our practices? Very often our constituents will say, I can't see my GP. Well, usually, if you probe, it's a question of whether they are prepared to accept a telephone consult, which is probably as good for the majority of our constituents. And touching upon the remarks made earlier about radiology, the issue for the future surely is embracing technology, not outsourcing, and AI reading of films and scans is probably as good, if not better in many cases, than simply a radiologist in India or in Shropshire or wherever you like.
Dr. Ben Spencer.
Well, I'm very grateful for the intervention. Absolutely agree in terms of the use of AI to improve productivity in the NHS, and also in terms of regarding our general practices. I generally take a sort of very neutral, honest broker approach to when people are raising concerns about practices. Of course, it's important that we make sure our practices are performing. It's important that we support them and we respond to constituents' concerns more broadly. But I think, given that a bulk of care is coming through general practice, and I was very interested to hear in recent days the renewed focus in terms of patient choice, particularly when it comes to secondary and tertiary care. I'd like to point out, I think one of the challenges with the current general practice system in the UK is around an absence of patient choice. Effectively, GPs, which, as the Minister will know, which are private organisations, have a monopoly in terms of the patients which are in the catchment area. Patients can't move, or at least it's very difficult to move, to different GP practices if the ones that they're going to aren't particularly meeting their needs. And when one is seeking a GP appointment, you're sort of stuck with your own practice, or you go to various different mechanisms to get care elsewhere. The previous government... Of course.
I think my honourable friend is making an excellent point, and it's something which is actually affecting my own constituency in Basildon and Billericay at the moment. We've actually seen in Billericay the South Green surgery being removed recently, is going to be closed down, and the ICB aren't ensuring that we retain that competition within Billericay. Basically, one surgery is going to be serving one of the towns in my constituency. Does my honourable friend agree with me that actually we should be, wherever possible, the DH nationally should be leaning in to ensure that we actually maintain that essentially competition between GP surgeries in order to ensure that we have standards driven up wherever possible?
Well, I thank my honourable friend from Basildon and Billericay for making this point, and he is absolutely right that it's important that patients have information, they have choice and have the flexibility to move between different practices to suit their needs. My view is the doctor list, the GP list system doesn't work. It doesn't make sense as currently stands, and it limits the ability of patients to seek the care that they need in a timely manner. And as he just mentioned, people get stuck in practices which aren't performing or aren't working for them, and there's no ability to sort of move out of it. But he also mentions the role of the ICB, ICS system, and this was the final point I was going to make. Because what I find incredibly frustrating is that as a constituency MP, I have no direct control or power or hard influence, as opposed to soft influence, on the local ICS, ICB system. I can write letters, I can campaign, I've had spoken in debates in Parliament, had a debate about the Weybridge Health Centre, which finally is now going to planning after a complete drama of multiple consultations. My only ability to really direct what's happening at ICB is through ministers, and that's either directly asking questions to ministers in Parliament or trying to get them to intervene in terms of what's happening with the ICB. When the Health and Care Bill was going through Parliament in the last Parliament, I raised to the Minister my concerns around the accountability of our ICS and ICBs. I think we have a real problem here in terms of what we as MPs can do to make sure that our ICBs, ICSs are performing for people locally. I think there is a disconnect in the link of accountability, because I believe the Secretary of State for Health and the ministers in front of me absolutely want to see all our local NHS services performing at their very best. I have faith, I totally believe they're in it for the right reasons and they want to see performance, and I want to help them deliver that. But the problem is I just can't believe with all the enthusiasm and will in the world, are they going to take the same amount of focus and interest in my local area as I am? And I think with that, we as MPs need more direct ability to cajole, to direct what our local NHS services are doing to deliver the best possible care for patients. After all, we are the locally elected representatives, and as we saw in this year's election and elections going forwards, it's always 24 hours to save the NHS.
Sir Jan Joseph.
Thank you, Madam Deputy Speaker. Addressing backlogs in the NHS, together with changing the current hospital-centric system, will be of central importance in ensuring the long-term sustainability in our health system. Under the Conservatives and the coalition government, we had decades of underinvestment coupled with disastrous top-down reorganisation, which caused the high level of backlogs we currently see across the NHS. While working in the NHS throughout this period, I saw at first hand the dire impact this had on our health service and how it led to waiting lists at a record high and patient satisfaction at a record low. This was underlined by the recent analysis from the IPPR showing 25 times more people waited in A&E departments last summer when compared with the same period in 2009. In their analysis, the IPPR described long waits for healthcare as the new normal for many patients in NHS. I welcome the measures that my right honourable friend, the Health and Social Care Secretary and his team of ministers have introduced already to address this. I also welcome the measures that the Prime Minister announced this morning. Thanks to this Labour government, the NHS in England will receive a record £25 billion investment, which will support the government in meeting its target of 40,000 extra elective appointments a week. I pay tribute to the dedication of my former colleagues across the NHS who are working hard to treat patients as quickly as possible and cut waiting times. There is evidence of this happening in my area of East Kent. For example, in November 2023, in William Harvey Hospital in Ashford, there were an average of 84 patients per day who were medically able to be discharged, but with nowhere to be discharged to. In November 2024, that figure was down to an average of 58 patients per day. In the hospital in East Kent in November 2023, just over 2,000 patients were treated in corridors over 30 minutes. In the same month last year, that figures had fallen to just over 1,600 patients. Although these figures are going in the right direction, they are still far too high. No one working in NHS will claim otherwise. While the staff in the health service will keep doing their best to clear the backlogs, this will not happen until we see less of an emphasis put on patients being treated in our hospitals. We need to see more focus and resources put on community-based services to help reduce the pressure on overburdened hospitals, as well as changing the system so that people are treated closer to where they live. As a former mental health nurse, I believe this must also include more timely interventions to treat those needing mental health support. Currently, not only do too many people end up being treated in hospital, when patients are there, the absence of enough sustainable, suitable community-based facilities means it is difficult to discharge them. This leads to further backlogs in the system. As the co-chair of the APPG on adult social care, I also want to briefly say how much I welcome that this government recognises that without addressing the social care crisis, there will be more and more people left without the care they need, and further pressure will fall on the NHS. I am pleased that the government have announced an immediate 86 million boost to the disabled facilities grant for this financial year. This is in addition to the 86 million that was announced at the budget. Together, this funding means thousands more people will be able to make the improvements they need to their homes so they can live more independently. Thank you.
I call Helen Maguire.
Thank you, Madam Deputy Speaker, and I thank the Honourable Member for North Shropshire for securing this debate. The backlog in the NHS is a national crisis, and it is acutely felt in my constituency of Epsom and Ewell. Patients, families and staff are bearing the brunt of an overstretched and under-resourced healthcare system. This morning, I was delighted to see the Prime Minister and the Health Secretary in my constituency, in Epsom Hospital, part of the Epsom and St Helier Trust, to announce this government's plans to tackle the backlog of tests, checks and treatments. I welcome many aspects of today's announcement. Direct access to checks, cut unnecessary waiting times, and if implemented well, will result in better patient outcomes as health issues are found earlier. The location of this announcement at a hospital connected to St Helier Hospital was particularly potent. Over the Christmas period, St Helier Hospital, which has been at the heart of healthcare in the community for generations, made the news again. Its sinking floors and leaky ceilings illustrate the failings of our NHS. The facility is failing. Some of the buildings are older than the NHS itself, and it is plagued by damp, mould and structural issues that impede patient care. The hard-working staff at St Helier Hospital are doing their best in impossible circumstances, but the reality is that the current infrastructure hampers their ability to provide the level of service and quality care my constituents deserve. Epsom Hospital too is struggling to cope with demand. Over the winter recess, I heard harrowing stories from constituents who face unacceptable A&E waiting times. One mother brought her child to Epsom Hospital for a suspected broken wrist and endured a 7-hour wait for an X-ray, finally leaving in the early hours of the morning. While there, she encountered another mother with a 9-month-old baby who had a bump on its head. They left after 6 hours without being seen because they could simply not wait any longer. One constituent's 86-year-old mother was told by the 111 service to go to A&E at Epsom Hospital after an injury, only to be informed that it would be a 10-hour wait, asking her to stay up until 2 a.m. after a potentially serious injury. These are not isolated incidents, but rather the lived reality for many families. These delays stem from a combination of rising demand, staff shortages and an ageing infrastructure that cannot keep pace. While I welcome elective care capacity will increase, hopefully reducing the waiting times for care for many patients, this must also come with a focus on improving emergency care. Ring-fencing elective beds while people wait for emergency care, dying in waiting rooms and corridors or leaving without being unchecked is nonsensical. We must increase the number of staffed hospital beds to end degrading corridor care. Further, there must be a qualified clinician in every waiting room to ensure any deteriorating conditions are picked up on. Locally, it's vitally important that Epsom and St Helier hospitals are at the front of the queue for necessary repairs and that the new specialist emergency care hospital in Sutton is at the top of the priority list for this new hospital programme.
On that point,
I'll give way.
we give way. I thank my honourable friend for giving one. A point. Epsom and St Helier Hospital Trust covers my constituency of Sutton and Cheam as well, and many of my residents rely on the hospitals at both Epsom and St Helier for their care. Does she agree with me that it is an absolute failure of the previous Conservative government to deliver one of the promised 40 new hospitals from 2019 that has led to the degradation in care for both of our residents across both of our constituencies? In addition, does she agree with me that the government must come forward with that funding that both our constituencies need and our residents need to reassure them their healthcare needs will be met into the future?
Helen Maguire.
I thank the member for the intervention. I absolutely agree. This is partly a failure of the previous Conservative government that the hospitals have not been built, and it is absolutely vitally important that Epsom and St Helier hospitals are put at the top of the list as priority for new hospitals. The new hospital will improve outcomes by consolidating critical services under one roof, easing the strain on staff currently stretched across 2 sites. Moreover, it will enable Epsom and St Helier hospitals to focus on elective care, diagnostics and outpatient services, helping tackle the backlog more efficiently. Crucially, the new hospital will expand the overall number of beds by centralising major acute services. Estate challenges will be addressed, staffing levels will be strengthened and patient outcomes will improve, reducing the intolerable waiting times currently experienced at Epsom and St Helier hospitals. I turn to the distressing delays for ADHD assessments. The September 2024 DARSA report highlighted a stark reality. Demand for ADHD assessments has grown so significantly that it risks overwhelming available resources. Nationally, it could take an average of 8 years to clear the backlog at the current rates. One of my constituents, Sophie, has been facing the brunt of this backlog. She's been waiting since June 2020 for an adult ADHD assessment, and she will be waiting quite a bit longer as Surrey and Borders Partnership NHS Foundation Trust has informed me that they're currently addressing referrals from as far back as March 2019. And the root cause is a mismatch between demand and funding. The service was commissioned to support 400 assessments annually, but now receives 400 referrals every 2 months. Sophie, like many others, has been advised to seek private assessment, an option financially out of reach for her as she's been unemployed due to her symptoms. It's an inefficient system that should be reconsidered to help reduce the enormous backlog, and this situation is wholly unacceptable. I will give way.
Currently, a third of children with a serious eating disorder are not seen within the NHS waiting time standard. Does the honourable member agree with me? Such delays only make matters worse, leading to sicker children, more suffering and greater costs to the NHS.
I thank the member for giving way, and I absolutely agree. Prevention is key here. If we don't deal with issues immediately, then it would just takes longer and it's more costly in the long term. But to conclude, the people of Epsom, they simply deserve better. They deserve a healthcare system that works for them, not against them. And I urge the government to act swiftly to address these issues and to deliver the investment and reforms our NHS so desperately needs.
Julie Minns.
Thank you, Madam Deputy Speaker, and may I wish you a very happy new year. Before I begin, I should like to declare an interest in that my daughter is an NHS nurse. My constituency of Carlisle includes Cumbria's only city, but also a vast rural hinterland, stretching from Rockcliffe in the west to the outer edge of the Northumberland National Park in the east. Whilst rurality of my constituency and its relative geographic isolation makes getting to appointments challenging, getting an appointment at all is by far the greatest challenge. As of October 2024, the waiting list for NHS North Cumbria stood at 43,000. As for the 92% NHS target for patients waiting for elective treatment to be seen in 18 weeks, that stood at just 59%. However, in 2010, that figure was 93.5%. And in 2010, public satisfaction with the NHS stood at 70%, the highest ever recorded. By 2023, it had hit an all-time low of 24%. So let's remind ourselves what happened between 2010 and 2024. First, as my honourable friend has already outlined, we had the disastrous Lansley reforms. Reforms that the King's Fund described as a major distraction for the NHS that caused huge unnecessary upheaval and created an unwieldy structure with fractured leadership. On top of these reforms, the Conservatives led a decade of underinvestment in our health service, where spending grew by just 2% a year in real terms between 2010 and 2019, well below the long-term average in England of 3.8% a year, which we had seen since the 1980s. That meant when COVID struck, the NHS was already severely constrained in what it could do. The result is overall waiting lists have risen to 3 times their level in 2010. 18 weeks is now more like 18 months. That is the record of 14 years of Conservative government. And it is why I am relieved that our NHS is no longer in their hands. As the Prime Minister set out today, this government has a plan. By creating millions of extra appointments, we will finally get to grips with our backlog and give millions of people back their lives and their livelihoods. I'm also delighted that there is a recognition of the importance of providing services close to people, something that is vital in rural constituencies like mine. This and the injection of £26 billion into the NHS will make a real difference for millions of people right across the country. And we're already seeing that difference in Carlisle, with the approval of a new £12 million urgent treatment centre at the Cumberland Infirmary, which is set to open by the end of this year. I'm also delighted that North Cumbria will be one of the beneficiaries of the new £45 million pot set aside to create health and growth accelerators. These will not just improve health outcomes locally, but also research the most effective approaches that can help people back into work and able to stand on their feet. That is Labour's plan in action. This government will set the shattered bones of our NHS.
Order. Gregory, Stafford.
Thank you very much, Madam Deputy Speaker. I welcome this debate, though we've had a number of health debates over the last few sitting days, which have crystallised, I think, the real problem that we are seeing in the NHS. What's been stark to me is nobody on the benches opposite, no honourable member on the benches opposite, has mentioned COVID thus far and the massive impact that it's had. And the honourable member for Carlisle is pointing at herself, but she seems to have, she might have mentioned it, but she had no concept of what the absolute devastation that took on our services. Now, Madam Deputy Speaker, I used to work for, just before I came into this House, for the Getting It Right First Time programme, an NHS England programme that was initially funded by the Right Honourable Member for Godalming and Ash when he was Health Secretary and again when he was Chancellor of the Exchequer, a programme that made a significant difference at getting rid of what was called unwarranted variation within the NHS. Because we have to admit that whilst there is some amazing service, some amazing treatment, some amazing patient care within the NHS, there is also some poor patient care. There is some inefficient patient care. And what the Getting It Right First Time programme was trying to achieve, and which I hope it will continue to achieve under this current government, is to improve patient care and make sure that the worst performing trusts are brought up to the level of the most performing trusts. And that includes areas, what we would like to call high volume, low complexity work. For example, cataracts or hips and knees operation, massive backlogs within the NHS, but which could be cleared if some of those failing trusts actually reach not even the top trusts, but even the top quartile or the top 10%. Now, the government... Yes, I'm happy to go away.
I thank the Honourable Member for giving way. He worked in the NHS before COVID, as did I. Does he not recall, he mentions the impact of COVID, but does he not recall that in December 2019, before COVID hit, waiting times against 8 weeks had already fallen to 84% against the 18-week standard? So why was that allowed to happen under the previous government?
Gregory, Stafford.
Well, I think the Honourable Member will remember as well that the reality is the pressure on the NHS, I accept, was way beyond COVID. But COVID was I'm afraid, the point which broke, using the Secretary of State's term, broke the NHS at that point. And it's taking a long time to recover. Now, I think the government is absolutely right in pushing for more localised services, bringing services closer to the patient. And access to GPs is a fundamental part of that. But we already know that GPs are overstretched. Now, the previous government really pushed Pharmacy First, which I think was a superb programme, and I know the current government wants to go further with that. But there are disincentives for general practitioners to embrace the Pharmacy First programme. So I do ask ministers, what are they going to do to ensure that there is no financial disincentive for GPs to work with pharmacy to ensure that we deal with the backlog in that point? There has to be a financial incentive. I think what was concerning about the statement today from the Secretary of State was the lack of real, genuine reform. There was a lot of rehash of previous policies, perhaps eking it out a tad further than the previous Conservative government went. But as I think the Secretary of State himself said, if anyone is going to be able to reform the NHS, it is a Labour government. And whilst I was quite interested in what the Secretary of State was saying when he was Shadow Secretary of State, I've been deeply disappointed with what he said since. It appears to me that, unfortunately, the union paymasters and the inertia within the NHS has captured him and his front bench. I hope I'm wrong, and I hope the Minister is going to tell me differently this evening, but that's where I've been. Locally, the reality is there is a problem with being able to bring services closer to home. My honourable friend from Runnymede and Weybridge mentioned the problem of accountability with ICBs. Now, I have the fortune or misfortune, depending on which way you look at it, of being covered, my constituency being covered by 3 ICBs. And they are, let's say, to use a previous term, there's a lot of unwarranted variation in the way that they deal with my constituents and me as a Member of Parliament. A big issue in my constituency in Bordon is that we want a brand new surgery in the area, but there seems to be no conversation with the ICB about how that's going to go ahead. Likewise, in Hazelmere, we are really keen that Hazelmere Hospital moves from being a district hospital into having an urgent treatment centre. It's absolutely vital. We need to get that moving. And likewise in Farnham, the community hospital in Farnham also could be somewhere that treatment could be done close to home. So I urge the government, don't sit back, use your majority and reform the NHS for the better of all our constituents.
Peter Prinsley.
Madam Speaker. I had expected to tell the House that I'd come straight to Parliament from my operating theatre in Norfolk, where I'd been dealing with ENT backlogs this morning. But late last night, I received a call telling me that my operating list was cancelled because there are no beds. No beds in the purpose-built day unit opened only a few years ago to avoid this issue. Every surgeon in the country will be familiar with this, and in every hospital, there are surgical teams sitting idle, waiting for beds, like a fog-bound airport where nothing can take off. But still, there are enormous backlogs across almost all of surgery, and especially in gynecology and orthopaedics. We're short of theatres, short of anaesthetists, short of scanners. Our patients are suffering and deteriorating in front of our eyes, and some of them are dying. We're short of all manner of specialists, including crucial diagnostic radiologists and pathologists. Delays in diagnostic imaging and reporting are very problematic, with more than 1.5 million on the waiting list to receive a diagnosis. But the Labour government will deal with the massive NHS backlogs, because we did it before. From 1997 to 2010, we abolished the waiting list, but in the period 2010 to 2023, they reached record levels. And now we see access to GP, dentistry and all routine surgery as the political emergencies they are. We can all hear terrible accounts of the consequences of such delays from our constituents. We know them firsthand from our own families. My son, who is an A&E doctor, describes trolleys of elderly incontinent patients, two abreast in the corridors and in the car parks, unable to admit his patients right here in London. We know we must rebuild our hospitals, and we'll start with those that are actually falling down. My constituents were so pleased to hear that both the Prime Minister and the Chancellor promised here in Parliament to replace the West Suffolk Hospital in Bury St Edmunds. May I carry on, because I've got very little time? I'd like to speak about general practice and care in the community, and I'm glad that the Prime Minister has made this a central part of his plan. General practice is the front door to the NHS. Patients who have a genuine connection with one or two GPs are less ill and live longer. There's an illuminating article entitled Closer to Home in this month's Fabian Review by my Suffolk GP colleagues Drs Reed and Havard, who reimagine GP as a comprehensive community health service close to the patient with multi-professional teams of health workers, including mental health and district nursing, all in one place. Patients knowing who their doctors are and knowing that the community health centre is the place to go. Let's call them Bevan Community Health Centres. We really can manage most clinical problems in the community, and investing in our brilliant GPs is truly the key to the crisis. Community hubs with diagnostic capabilities for larger populations and only send people to hospital who need to go to hospital. We must do something about productivity. I started my career with 4 workers in the theatre, operating on 8 children, only to reach a situation today of operating on 4 children with 8 workers. So, as we reform and rebuild our NHS, let's bring the 1.5 million staff with us on this great journey, for it is upon them that we and the NHS depend. The measures announced today will surely help, but only if we can find enough staff and invest in training. Let's look after those who look after us. Fair pay, fair conditions, and a great deal of respect. That must be our mission.
Yeah. Zoe Franklin.
Thank you, Madam Deputy Speaker. Before Christmas, I shared in this chamber the issues impacting my Guildford constituents who are struggling to access SEND support. And today I want to highlight an aspect of the NHS that is directly linked to the SEND issues I raised then. And that is child and adult mental health services, better known to most of us in the chamber as CAMS. Unlike many SEND-related issues, CAMS doesn't sit within the remit of education, but instead health, as it requires significant input from NHS specialists. The first step to getting help from CAMS is usually a referral for an assessment. However, the waiting list for some is up to 3 years. This is why I am raising it today in this debate. A long wait for an assessment leaves young people without support, a diagnosis, and has wide implications. A young person's mental health can deteriorate during that wait, which can lead to self-harm, lashing out and harming members of their families, even suicide. And imagine going through this as a parent, watching, often helpless, to support your child, while the system designed to help does not. And even if you do eventually get a CAMHS assessment, there are well-documented shortages in medication and problems accessing therapies. A son of one of my constituents was diagnosed with ADHD and ASD in April 2020, but received no follow-up appointments. While his family said this was manageable initially, his school performance began to decline towards the end of 21-22, leading his family to seek a review with CAMHS in Feb 23. 20 months on, the review hasn't taken place. His parents sought support to prepare for GCSEs, even if the medication had to be delayed, but they were met with a system unable to provide even basic support. They now face an indefinite wait with no resolution in sight. Another constituent has been fighting for support for her 13-year-old daughter, who's been waiting over 2 years for an ADHD and PDA assessment, despite the mother pleading for help for 7 years. This single-parent family has endured systemic failure, leaving the family suffering to an extent that I'm not going to go into detail about today. The prolonged wait for an assessment has taken a devastating toll on both of their lives. It is clear action is desperately needed to ensure the resources are there to support young people and their families through the CAMHS system, and that medication shortages are addressed. So my question today to the Minister is, how is this Labour government working to recruit and train more professionals, firstly to clear the CAMHS backlog, and secondly ensure that going forward the service is able to respond in good time, not years, to requests for assessments and support? Too many young people and their families are being failed by the current system, and it's time this comes to an end.
James Frith.
Thank you, Madam Deputy Speaker, and a Happy New Year to you. If you'll indulge me briefly, can I begin by wishing my own grandmother well? She had a fall last night and broke 2 of her ribs. She's doing okay, but at 98, she may need a little longer in hospital than I, her eldest grandson, might have needed, although that is not a given, actually. Deep-rooted health inequalities in Bury North are my priority for this Parliament, where the difference of a mile up the road between postcodes can mean a 7-year difference in life expectancy for men and 5 for women. It's a top priority for me as an MP, and I would like just to reach across the aisle and associate myself with the remarks made by the good doctor, the MP for Runnymede, who has previously spoken very well in the assisted dying debate, but talked of what I would call the democratic deficit that us as MPs have in relation to not just our ICBs, but reaching in to some of that health inequality and enacting at a local level well beyond that which we might get through parliamentary questions or writing to ministers and meeting with ministers. But I am pleased that Labour will not allow the dire record of the former Tory government and the party opposite of their wasted years in government to prevent us from doing what Labour does best in power, fixing and fast-forwarding the NHS. In Bury North, a constituent I shall call Jackie has rheumatoid arthritis. After a severe, debilitating flare-up, she waited 2 days for her GP to call her back. She spent 8 hours waiting in 2 different hospitals before being admitted overnight, only to be discharged the next day, told to go to a 3rd hospital where there were no rheumatologists in place. Her emergency appointment was 11 days later. Left in tears, unable to speak for herself, her husband had to advocate for her to get the appointment she desperately needed. NHS backlogs take a personal and punishing toll on people's lives, including lost income from lost jobs, or worse still, lost years with loved ones from late or missed cancer diagnosis. So today's commitment from the Labour government that 92% of NHS patients will wait no longer than 18 weeks for treatment by the end of this Parliament is an enormous transformative ambition. For that figure, currently at 59%, to improve rapidly to 65% by March next year, will give comfort to those rightly expecting to feel the change Labour will bring to their doorstep. I also welcome community diagnostic centres, ensuring they can operate 12 hours a day, 7 days a week, And thanks to the Chancellor's budget, local doctors will be incentivised to consult with specialists to explore alternatives to hospital treatment. In Bury, where Fairfield General Hospital has the second highest average wait times for elective surgery in the country, the new national standards for elective care are welcome. But can I ask the Minister, incentives for trusts to improve wait times are welcome, but will she confirm if she agrees with me that this focus should be on average wait times affecting the maximum number of patients, not just rewarding or awarding trusts who reduce the longest possible wait time for fewer patients? I understand the capacity demands that come with this, but it's a hugely important distinction. While reducing the longest wait times are important, focusing solely on that metric and rewarding that alone leaves many patients with painful, debilitating conditions and trusts ducking the responsibility I think this government has made very clear for us to address on our watch. Thank you, Madam Secretary.
Clive Jones.
Thank you very much, Madam Deputy Speaker, and can I thank my honourable friend, the member for North Shropshire, for securing this debate. I declare my interest as the Governor of the Royal Berkshire Hospital and that a family member has shares in a medical company. It is a simple fact. As a result of the last Conservative government, more patients than ever are waiting for hospital treatments. In October 2024, the national waiting list stood at 7.5 million, and House of Commons library data reveals that the waiting list for hospital treatment locally is 7 times worse than the waiting list was a decade ago. 10 years ago, 91.9% of patients in Berkshire West waited less than 18 weeks for elective surgery. Now the figure has dropped to 75.5%, well below NHS targets, and is completely unacceptable. Where is the acknowledgement and apology from the previous government for the mess that they've created? A backlog means that people's conditions worsen, forcing more complicated surgery, leading to slower recoveries, worse outcomes, and a reduced quality of life. For many people in Wokingham, they receive their hospital treatment at the Royal Berkshire Hospital. Royal Berkshire Hospital is important to me. It's where my children were born and when my cancer was discovered. Their dedicated staff are the pride of our community, and they are employing innovative practices to try and reduce the existing backlog. For example, they expand their virtual hospital and are now able to treat 124 patients from the comfort of their own home who would normally be in hospital. However, their situation is continually worsened by a crumbling estate. 95% of the lifts are beyond their end of life, and they have had to cancel operations due to infrastructure issues. Today's announcement that extra investment will be provided to hospitals that cut waiting times fastest is putting the cart before the horse. How does the Secretary of State expect the Royal Berkshire Hospital to meaningfully cut waiting times when the department is unable to set forward the next steps for its urgently required rebuild? I and other honourable members will continue to pursue the matter until we get government action on this. Can the Minister please set out when the new hospital programme review will be published? The rebuild of the Royal Berks is especially important for the Cancer Centre. This is in a building where some parts of it are 164 years old. This is where people perhaps are being treated in the last years of their lives. Urgent investment is crucially needed. I was delighted to secure a commitment from the government for a national cancer strategy for England. This is a very important step forward. The government's cancer strategy needs to clearly set out how it will improve cancer waiting times and tackle outcomes. I hope that this can be done before the second reading of my private member's bill, which is on July the 4th. However, I fear that today's announcement regarding the 18-week target is pitting knee replacements against radiotherapy. Cancer affects 1 in 2 people in the UK and is expected to increase annually with 30% more patients with cancer. And yet we have a staggering workforce shortage in almost every staffing group, insufficient capacity, and more than 1 in 10 referred patients waiting more than 104 days for treatment. Is the Minister still committed to meeting cancer waiting times in this Parliament.
Josh Fenton-Glynn.
Thank you, Madam Deputy Speaker. I welcome this debate today. Another winter, more severe backlogs. The causes are structural and predictable. The shadow of what Lord Darcy found weighs heavy on this debate. 14,000 unnecessary deaths in A&E each year. Waiting times for over 65 in emergency care more than doubled to 7 hours. Over 100,000 under-3s waiting over 6 hours to be seen in 2023. Each one of those, a devastated family, a patient at greater risk, or a parent enduring that long, nervous wait. This winter, my local hospital trust has seen an average bed occupancy rates hit 98.5%, with at one point in mid-December, only 3 out of 715 beds were free to use. The crisis in our NHS that my constituency Calder Valley face is not through lack of work by our NHS staff, and I hope everyone in this House can join me in paying tribute to those hard-working NHS staff. Yeah. Instead, this crisis has come about because of bad policy choices, warnings repeatedly ignored. Indeed, in his report and when he came to our Select Committee, Lord Darcy made absolutely clear that the root cause of the problem is the 2012 Health and Social Care Act that was pushed through without precedent or preparation by the coalition government amidst repeated warnings from healthcare professionals. This disaster proves that to move forward, we have to learn from why bad health policy gets made, because of a focus on ideology over practicality, on efficiency savings over real improvement, and on treatment over prevention and later life care. And we must also learn that to rebuild our NHS, we can't be top-down, but build on a foundation of decent social and community care, close to home and respecting the skills of those who work throughout the system, which takes me to my next point, social care. The scale of the crisis in the NHS means it won't be fixed overnight. Indeed, the Secretary of State talks about a 10-year plan. But we know that the problems are solved easier and earlier if patients are treated closer to home. Yet the failure over the last 14 years to plan health and social care together means that more than 1 in 10 NHS hospital beds are filled with people who simply don't have the right care. Absolutely.
Thank you, and thank you for giving way. In Shipley constituency, Bradford Council's Home Fast scheme aims to get people home from hospital more quickly and be assessed for any onward care services when they are at home. Since its launch, there's been a really large reduction in the need for intermediate care facilities after hospital care. I just wondered if my honourable friend agreed with me that it's innovations like that that need to be at the heart of the government's 10-year plan, ensuring that we integrate health and social care, as he was saying, but perhaps also looking to revise the Better Care Fund so that it delivers both rapid discharge and rehabilitation, obviously both things that are really critical to tackling NHS backlogs.
Thank you. I thank my honourable friend for giving way. In fact, the Better Care Fund works best, in particular in West Yorkshire, when it works to hasten people's journey out of hospital, and that sounds like a very good example. In my own local hospital trust, the figure for people on the transfer of care list is even higher. 20% of beds are taken up by people who could be treated at home. That's almost 150 patients in hospital rather than getting social care where they need to be. Even well-run trusts are finding the wait for transfer of care too great, proving again that we can't fix our health service without fixing 14 years of Tory mismanagement or without fixing social care. So in closing, Madam Deputy Speaker, while this government faces problems not of our own creation, we must still learn from what has gone before. In this regard, I absolutely welcome the announcement on progress in social care today, but I would gently express to the Minister, as I did to the Health Secretary at his committee appearance, that we do need to see action on the ground solving our social care crisis earlier than 2028. In 2023, the National Audit Office told us that nearly 4 in 10 directors of adult social services were worried about meeting their statutory obligations. On top of that, we have a provider crisis because of this instability. The electorate gave this government a term of 5 years to take bold steps to reverse the crisis in our NHS. They rejected the previous government because they wasted each of their terms over 14 years of failure to enact a solution on social care, leaving people in hospital instead of able to receive care among family and friends. I look forward to this government acting on that mandate. Thank you.
And I will be starting the front bench speeches at 9:35, so our very last backbench speaker, Ellie Chowns.
Thank you, Madam Deputy Speaker, and I'd like to thank the Honourable Member for securing this debate on this vital issue of NHS backlogs, which is of great importance to me and to my constituents in North Herefordshire. Now, we're short of time, so I won't talk as I wished to about the need to tackle the crisis in social care and the need to invest in a really heavy way in public health. I'll focus my comments today, in particular in responding to the government's announcement today on elective care. And I hope the Minister will be able to respond in her response in a moment to some of the questions that I'd like to pose, because it's one thing to use spare capacity within the private sector to tackle the absolute crisis that we have in terms of waiting lists and backlogs. I can understand that as an emergency measure, but it's quite another to propose long-term, effectively outsourcing from the NHS to private providers. And I fear, to be honest, that today's announcement could be essentially a form of creeping backdoor privatisation of aspects of NHS care, specifically those in which it is easiest for those private sector providers to make profit. We only have to look at PFI to understand the dangers of that approach. And I have read today's partnership agreement between the NHS and the independent sector. I've read it, and I'm afraid I find it the opposite of reassuring. If I just briefly canter through some of the reasons why. In section 2, it indicates that the government does envisage increased private provision of both surgical and diagnostic services. There's some text in section 3 which is about trying to seek assurance that those private providers won't cherry pick essentially the most attractive, easy, most profitable patients, but all it says is that the independent sector will review its patient criteria. There's no teeth there to that. Section 4, there's nothing in there about measures to protect the NHS from the risk of private providers making excessive profits from the services they provide. We've heard in this chamber recently cases of that happening within the social care sector, within the children's social care sector. Is there not a real risk that that could also happen within the healthcare sector if this is not actioned on? And finally, Madam Deputy Speaker, in section 5, there is, I think, nothing there that will address the risk of transfer of services to private providers leading to leaching of staff from the NHS services into the private sector. How are we going to be guaranteed that there isn't going to be excessive competition in a workforce that is already extremely stretched? So for myself, for the Green Party, the profit motive has no place in our NHS, and I very much hope that the Minister will provide some assurances on this count that the NHS will continue to be publicly owned, publicly run for public benefit, and that these concerns I've highlighted will be addressed so that we have teeth in the agreement between the NHS and the independent sector. Thank you.
I now call the Liberal Democrat spokesperson, Jess Brown-Fuller.
Thank you, Madam Deputy Speaker, and thank you to my honourable friend for North Shropshire for bringing forward this important debate on our first day back after Christmas, and thank all honourable members from across the House for their contribution to the debate, but I would like to specifically thank the honourable member for Runnymede and Weybridge, the honourable member for Ashford and the honourable member for Bury St Edmunds and Stowmarket, who always bring really valuable contributions because of their background and current professions. It's very much appreciated when we're talking about the NHS. And the honourable member for North Shropshire, in her opening remarks, highlighted to the House that it's not just about NHS waiting lists when we think about backlogs. It's mental health backlogs, handover delays, A&E waiting lists, poor access to dentistry, GP appointments, cancer treatment waiting times, and staff that are being driven from the NHS because they can't provide the care that they want to give. Our healthcare system remains the number one issue that I am contacted about, and it is not unreasonable for my constituents in Chichester and across the country to expect to receive the care they need, when they need it, and where they need it. And I doubt there are many people that have not been affected or know somebody affected by NHS backlogs. Indeed, my dad struggled for months to get a face-to-face GP appointment for what he believed was a return of a hiatus hernia. But by the time he saw his GP and was referred, the esophageal cancer that he had was so progressed that only palliative care was an option for him, and he passed away shortly after being diagnosed in 2021. And when I asked my constituents to get in touch with their examples of personal experiences with the NHS backlogs, I was inundated with emails from people across Chichester, and I would like to share some of those with the House today. So I have Jane, who is at high risk of bowel cancer due to living with ulcerative colitis and is meant to see her consultant every 6 months, but she hasn't had an appointment since 2019, despite her GP trying on her behalf on multiple occasions. She has no idea if the polyps that they discovered in 2017 have turned cancerous and is living in constant fear of her health deteriorating further. Or Ian, who got in touch after waiting over a year to receive a scan after he experienced some extreme chest pain. The scan then revealed heart disease, but without any follow-up appointments, this has left him anxious and uncertain about his health. And I will also mention a good friend of mine, Riley. Riley noticed irregular bruising and a physical change on the back of their leg in 2021 and was finding it harder to walk. After visiting the GP, who sent an urgent referral to the hospital, Riley then waited months, only to discover when chasing the hospital that the referral had gone to the wrong place. They then got added to the waiting list, and they were told that that would be 40 to 50 weeks. We're 4 years on from the initial changes to Riley's leg, and they are finally being treated by leading specialists as Riley can no longer walk unaided. Amputation of their leg is now being considered. If Riley had been seen within the expected window of an urgent referral, they wouldn't be facing the prospect of losing their leg in their mid-20s. These are just a few examples of what is a much larger picture of the NHS with caring, compassionate staff working within it who are overstretched and overburdened, and as the Honourable Member for North Shropshire said, cannot provide the care that they desperately want to because of a system that cannot meet the demand. The Liberal Democrats recognise this is an inherited problem. Indeed, the key NHS waiting time standards have not been met for some years. The number of patients waiting longer than 4 hours in A&E rose consistently between 2015 and 2020. The 62-day waiting time for standard cancer treatment has not been met in recent years, and in England, the consultant-led treatment target of 18 weeks has not been met since 2016. The last Conservative government left emergency care in a deep crisis. The Darcy Review stated that in 2024, every day, 800 working days have been lost to handover delays. Last winter, ambulances across England collectively spent a total of 112 years waiting outside hospitals to hand patients over. And in 2024, over 1 million patients faced waits of over 12 hours in A&E. So Liberal Democrats welcome new investment in the NHS. But instead of spending money firefighting crisis after crisis, we would invest to save taxpayers' money in the long run. And we would do that by investing in the front door and the back door, in primary care with GPs and dentists, and by reforming social care. Some of my constituents would like it noted that they won't be counted on any statistics regarding backlogs because they can't get a GP appointment to even get on the backlog list. That's why the Liberal Democrats are calling for everyone to have the right to see their GP within 7 days or 24 hours if it's urgent, the 24/7 booking system to end the 8 a.m. phone call lottery to get an appointment. And we'd also ensure that everybody over the age of 70 and those with a long-term condition has access to a named GP. We'd fix the back door and address the social care crisis now, rather than spending another 3 years commissioning a report that will find out what we already know, that social care is in urgent need of reform. The Darcy Review showed that inadequate social care accounts for 13% of hospital beds, meaning people who desperately want to get home can't because of a lack of social care packages available, or those deteriorating at home because they can't access the social care they need, as in the last year, over half of all requests for social care were unsuccessful. And we would strengthen our emergency services to reduce excessive handover delays by increasing the number of staffed hospital beds and calling for a qualified clinician in every A&E waiting room to ensure any deteriorating conditions are picked up on to prevent tragic, avoidable incidents. Madam Deputy Speaker, I'd like to once again thank the Honourable Member for North Shropshire for bringing forward this incredibly important debate, and to those members who contributed to a conversation that matters to my constituents in Chichester and across the country.
Shadow Minister Dr Caroline Johnson.
Thank you, Madam Deputy Speaker, and a very happy New Year to you. And may I also wish the member for Bury North's grandmother a very speedy recovery. I should declare an interest as a doctor, consultant practice in the NHS. My brother is a GP, and also I am on an orthopaedic waiting list, so one of the statistics. I'm looking forward to working constructively with the government over the next year to deliver for patients across this country. The NHS has been looking after us for about over three-quarters of a century, and during that time the practice of medicine has transformed. Cures have been found and people are living longer and healthier lives. And across the country over Christmas, staff have been contributing, and I'd like to say thank you to all those working in the NHS and social care over Christmas and the New Year period. We all recognise that the NHS is under pressure. We have an ageing population, we have patients with more complex needs, and we have innovative but expensive treatments. The pandemic added a huge strain to the NHS. Resources were redeployed away from elective care, and much elective care was postponed to reduce the spread of COVID. For example, before the pandemic, 54 women had been waiting more than 12 months for a gynecological appointment. By the time the pandemic was over, that number had gone from 54 to 40,000. And this was replicated across not just gynecology, but across departments, across hospitals, across our country. So that although the NHS now treats 25% more patients now than it did in 2010, waiting lists are sharply higher. We took steps as a government to bring them down again, and these measures were working, though not as quickly as we wished. For example, the 18 months waiting list was virtually eliminated, and 52 weeks was steadily falling, despite the industrial action that occurred. Meanwhile, in Wales, where Labour have been in power for over 25 years, the waiting lists do continue to rise. Of course, there is more to do. No one is suggesting that the issue has resolved. Waiting lists are still too high, and that's why we funded the £3.5 billion NHS productivity plan in full to upgrade IT, to expand the NHS app, and to capitalise on the benefits of AI. This government was elected in July on a promise of a plan, but sadly this plan has still not yet been published. This government was also elected on a promise to deliver 40,000 more appointments per week, and I wish them huge success with this, but I'm not optimistic. The Secretary of State has been repeatedly asked when these additional appointments will come available, but there's been no clear answers. Could the Minister please provide one, or tell us what progress has been made? This morning we heard more about Labour's elective reform plan, and I was really pleased to hear they will continue with many Conservative initiatives which were working, such as expanding... I won't, because I've got a time limit to this time. I was pleased to hear they will continue many Conservative initiatives, such as expanding the Surgical Hubs programme, extending the work of community diagnostic centres. But some of the others were a little confusing. Patients are to have a choice of where they're treated, but they already do. They're also to receive text messages to remind them of appointment times. This is great, but it's already happening. In fact, I looked back through my phone, revealed the earliest text message I can find reminding me of an appointment for my child at Peterborough City Hospital was sent on the 28th of July 2015. So this is not a new initiative. Patients are to get results online. Well, again, they already do. If the Minister hasn't seen this, I urge her to visit Adam Brooks Hospital, where via the MyChart system, patients can already log on and read their MRI or blood result reports. Spreading good practice is to be welcomed, but it's not a revolution. It also faces significant headwinds. The government had a direct activity to general practice, but GPs are already rather busy and facing financial challenges caused by national insurance contributions. So how will shifting pressure improve capacity? When will GPs be able to budget? Will the funding settlement be greater than their increased costs from national insurance contributions? And if the resources are moved to general practice, how will this deliver more secondary care appointments? One person can only do so much work. So what is the government's plan for the workforce, which will be so key? And of course, it's not just the GPs that are affected by the national insurance contributions. The Secretary of State talked about record investment in hospices. But before Christmas, the Minister was repeatedly unable to say if this record investment would cover the raise in national insurance contributions those same hospices were facing. So can she update the House now? Patients are to have the choice on whether to have follow-up appointments, and this is apparently going to reduce 1 million unnecessary appointments every year. So will this be a choice for patients to have a desired follow-up appointment that's not recommended by clinical staff, in which case it could actually increase the number of appointments that are required? Or will it actually only be a choice not to have an appointment that the doctor or a clinician has recommended? In which case is that wise? It's cold outside, Madam Deputy Speaker. In fact, this morning I woke up to blizzard conditions at my window. What estimate has the Minister made of the number of extra admissions that have occurred this winter for elderly patients who have been cold due to the removal of their winter fuel allowance? And what impact on hospitals? I have heard the Honourable Lady, but I'm not going to give way because the Deputy Speaker has been clear about the time constraints on this debate. Right. It's cold outside. Thank you, Madam Deputy Speaker. Has the Minister made an estimate of the number of extra admissions caused by the elderly people who are cold due to the removal of winter fuel allowance? What impact is that having on hospitals, and how many elective appointments that would otherwise have occurred have been cancelled as a result? We heard the Honourable Gentleman talk about his cancelled ENT list from this morning. In summary, Madam Deputy Speaker, we've had 6 months of a Labour government. They've cancelled the building of 24 hospitals. They've launched a series of reviews. They've increased significantly the cost because of national insurances on indirectly provided NHS services. And they've re-announced what has already been happening in some cases for many years. Madam Deputy Speaker, I'm a doctor and I'm a patient, and I really want this government to succeed in improving the NHS. We all do. We've heard too many troubling tales from our own constituents, and again this evening. But stating aims doesn't make them happening, and launching reviews and press releases is simply not enough.
Will my Honourable Lady give way?
Minister Karen Smith.
Thank you, Madam Deputy Speaker, and may I wish you a happy new year too, and many honourable members. Now, can I thank the honourable member for North Shropshire for securing this debate on this date. I am delighted to be able to respond today. It's been a passionate and well-informed debate, and I'm genuinely grateful for the opportunity to build on what the Secretary of State said in oral statement today, because we have a great deal to say about our plans to build more capacity and give patients more power over their care. Now, colleagues across the House have set out how 14 years of failure has damaged their constituents, letting down the people we represent, and broken the NHS. This was starkly illustrated by my honourable friend from Bury, St Edmunds, who should have been doing something else this morning and wasn't. That's a loss to his patients, but also highlighted by the honourable member for Epsom and Ewell and for Wokingham. And the Lib Dem spokesperson, I think, outlined greatly how it impacted on her own father as well as her own constituents. Years of neglect, lack of funding and unresolved industrial action meant this government inherited an appalling backlog of people waiting for treatment, the 7.5 million strong waiting list. And if I can just gently remind the honourable member for Farnham and Bordon and the opposition spokesperson that that waiting list stood at 4 million people before the start of the pandemic. The Darcy investigation described how these waits were becoming the new normal, with patients waiting far too long for treatment, and as a result, public satisfaction with one of our most beloved institutions is at an all-time low, and eloquently put by my honourable friend, the member for Carlisle, who highlighted the figures from 2010 and now as they affect her constituents. On average, 58% of people do not receive treatment within their 18-week of referral. The NHS constitutional standard sets out how 92% of patients should receive treatment within this time frame, and this standard has not been met consistently for almost a decade. In other words, there are people today, younger than myself, Madam Deputy Speaker, who would have no memory of the NHS working efficiently and delivering a timely service. And colleagues are right to point out the impact on our constituents, with people putting their lives on hold while they wait for a diagnosis, a new hip or eye surgery. And if the human tragedy weren't enough, the economic and social effects of these waiting times are almost incalculable. And that's why today the Prime Minister has set out our plans to tackle hospital backlogs and finally meet the NHS standard of 92% of patients in England waiting no longer than 18 weeks for elective treatment. And I would like to confirm to my honourable friend from Bury North that is an average. And can I also wish his grandmother well? That's unfortunate for her time of life. So we hope she's getting good care. Our elective reform plan sets out a bold package of productivity measures and reforms to deliver fundamental change for patients by building a health service defined by patient choice and patient control. And if I can just say to the Honourable Member for Runnymede and Weybridge and Farnham and Bordon, I agree with them about local accountability, and my own comments on the 22 Act, which I think the government at the time should have done more on, are well made, and I encourage and regularly do all honourable members to engage proactively with their ICBs, and I think it's absolutely incumbent on those to engage with elected representatives on behalf of all our constituents. I certainly have always done with mine, and I commend everybody else to do the same. Under our plan, NHS care will be increasingly personalised and digital. We will focus on improving experiences and convenience, empowering people with choice and control over when and where they will be treated. Different models of care will be more widely and consistently adopted, following on from the Honourable Gentleman's work on GIRFT, which I also commend. We will roll out artificial intelligence and other technology to boost capacity and deliver excellent care consistently across the country. Now, I won't have time to go into all the details of all the drivers of this backlog, but just to highlight that, of course, we recognise the pressures on primary and community care and social care, and that's why we were able to put forward last month proper proposals for a new GP contract with extra money to slash red tape and bring back the family doctor, the biggest funding boost to primary care that we've seen. And I've also been really impressed by some of the fantastic work going on in women's health hubs. We can continue to welcome the cross-party support for our proposals on social care, and hope we do build that cross-party support for Baroness Casey's work. And social care was highlighted by my honourable friends for Ashford and Calder Valley, amongst others. But if the key drivers, if I can just highlight those, Madam Deputy Speaker, around diagnostics. We will reduce the waits for scanners by extending the work of community diagnostic centres to 7 days a week. Patients will be able to receive same-day tests and consultations, direct referrals from primary and community care, new consulting rooms and at least 10 straight-to-test pathways by March 2026. Pathway improvements will only get us so far, though. We are also setting clear expectations that funding must be used responsibly, providing the best value for money for patients and the taxpayer. That's why, under our plans, money will follow the patient, and those organisations that do the best will get the most reward, so incentives drive improvement. And if I can just say gently to the opposition spokesperson, many places do offer online access. I get texts regularly from my hospital because I'm also a patient, but it isn't universal. That's their failure in government. We want to take the best of the NHS to the rest of the NHS. On cancer, the 62 and 31-day cancer waiting time standards were last met in 2015 and 2020 respectively. Cancer is a priority for this government. Cancer patients are waiting too long for a diagnosis and treatment, and we are determined to change that. We will get the NHS diagnosing cancer earlier and treating it faster so more patients survive, and I assure the spokesperson for the Lib Dems that we remain committed to all three targets. We know swift diagnosis is key to improving outcomes and ensuring patients get a diagnostic and treatment quickly, so expanding CDCs is a core plank of achieving those standards. But we recognise that a cancer-specific approach is needed to meet the challenges in cancer care. That's why we will publish, after the 10-year plan, we will follow up with a dedicated national cancer plan, which will help us go further for cancer patients. Now, Madam Deputy Speaker, this government is tackling challenges beyond routine elective care, like the crisis in emergency care. Last month, a quarter of 2.3 million people who attended A&E waited for more than 4 hours, and in November, the average ambulance response time stood at 42 minutes, which is more than double the NHS constitutional standard. These do not come close to the safe operational standards set out in the Constitution. It will take time to turn things around, but our action to quickly end the junior doctor strike means for the first time in 3 years, NHS leaders are focused on winter preparedness and not planning for strikes. NHS England has set out a national approach to winter planning and is managing extra demand with upgraded 24-hour live data centres, strengthening same-day emergency care and offering more full services for older people. With regards to mental health, waiting lists are far too long, and we've heard about some of that this evening. We want to build on our mission and make sure we recruit additional 8,500 mental health workers to reduce delays. We'll also provide access to specialist mental health professionals at every school in England, roll out young future hubs in every community, and modernise the Mental Health Act. And as the Honourable Member for Guildford highlighted, young children and young families are being particularly badly affected. The Chancellor backed our plans in the budget with an extra £5.6 million over the next 2 years to open new mental health crisis centres and help reduce pressure on NHS. I'm afraid I would like to, but I do need to adhere to the time limit for the Speaker. So in closing, Madam Deputy Speaker, in the second reading of the NHS Bill, Nye warned us against following abstract principles on paper that don't work in the real world. This government is only interested in what works, and we know we must do things differently because the backlog began to build before the pandemic. NHS constitutional standards have not been met for more than a decade. Whatever the last government was doing, it wasn't working. That's why our elective reform plans will do things differently, giving patients more choice and more control over their treatment, making greater use of technology and the NHS app, giving patients the convenience of a 7-day diagnostic service. And in response to the member for North Herefordshire, we will use private sector capacity to help. Supporting patients is what matters. And we, as the party that founded the NHS, will always be committed to a publicly funded, free at the point of the NHS abuse. We are going hell for leather to get waiting lists down, rebuild our NHS and ensure it's there for us when we need it once again. None of this will happen overnight, but we're not asking to be judged by our promises. We will be judged by our results, and we are determined to succeed.
Yeah. Helen Morgan to quickly wind up.
Thank you very much, Madam Deputy Speaker, and looking at the time, I shall be extremely brief. I just want to thank all colleagues who've come along today to make such thoughtful and in some cases harrowing contributions to the debate. And I'd like to thank the Minister, the Shadow Minister and the Honourable Member for Chichester for her own contribution and for summing up so effectively the arguments that have been made today. I think everybody knows that the NHS is in crisis, that the government has acknowledged that, and that is welcome, and we all want to see things improved for our own constituents who are suffering the consequences of a system that is on its knees. And I welcome the government's announcements over the last few weeks, and I hope that they will listen to the constructive comments that are being made from our benches, because they are intended to deliver the NHS that our constituents deserve. And I know that the staff who work in the NHS want to be able to deliver. Thank you.
The question is, as on the order paper, as many as are of that opinion say aye. Aye. Of the contrary, no. I think the ayes have it. The ayes have it.